Hi, I'm Kelly Garver with Sterk Family Law. Today I'm joined by Dr. Kevin Dobrzynski at the Amen Clinics, who's going to give us a tour of the facility. Dr. Dobrzynski, thank you for taking the time.
Absolutely, I'm excited to have everybody. The Amen Clinics, even though it's been around for 30 years, we opened our first clinic here in Chicago about a year and a half ago. It's the fall of 2017, and so we're really excited to be in the community here in the North Shore of Chicago, trying to support families and individuals that may be suffering or dealing with things like anxiety, depression, attention issues, cognitive decline, traumatic brain injuries, bipolar schizophrenia, etc.
Very good. So I understand that you have like a four-circle approach, is it, that you work with?
Yeah, so that's actually how we assess people, is we look at the whole person. And so what that means is we look at the biology of the person. This could be their brain. It could also be looking at what's going on inside the body. For instance, taking a look at biomarkers or a blood test. Other things we do is we look at the psychology of the person. We also look at their social surroundings, and we look at their beliefs or their spirituality. So that's essentially our four circles approach.
Very good. Can you explain a little bit about the evaluation process when a patient comes in?
Sure. When patients come here, we take them through what we call a full assessment, meaning we start with questions. It's so important to know the history of the individual and where they've come from, and that's where we start addressing or looking at those four circles which I just described to you. But we'll also do a neuropsychological exam, which is done behind the computer, and for us, we're just looking for more information from the individual. Next, we actually have them and or their family members interviewed by what we call a patient outcome manager. So we'll sit down and literally interview that individual and the family for about an hour, hour and a half. And at that point, we'll go through and we image the brain. Ideally, we'll do two images. We'll do one at rest, and the other one we do upon concentration. So what that means is we just want to look at the brain working, and so we activate the brain through them taking a test. After we have all that information, we essentially give it to our physician. They sit down with the individual, the family member, and explain to them everything that's going on. So the evaluation starts to take place, the diagnosis, and then we set them up on a treatment plan and make suggestions from there. In our imaging center, we have the SPEC imaging cameras, which is actually a three-headed camera. And what's nice about SPEC, again, we talked about it being a functional image. It's a live blood flow image of the brain, so we can see what's going on in real time. But compare that to something like an MRI. A lot of people are familiar with having to go into a tube where it's loud. This is mainly an open bed that people lie on that slides into this triangle, if you will, and it rotates around the individual's head, so it's very quiet, there's no noise, people are very, very comfortable, and at the same time, we have a technician who's able to see those images coming through in real time to make sure everything is okay, and then after those images are taken, they go to California where we have a team actually reading those images. So that's essentially how the operation works inside the imaging center. So with hyperbaric oxygen therapy, it's one of the services, we don't have a lot that we use here in the clinic, and we use it with cases such as neurodegeneration of the brain. So this could be dementia or Alzheimer's, where we can see that the brain actually has reduced blood flow. We also use that with addiction or where the brain may be damaged due to toxicity. That could be Lyme or mold disease. And then lastly, we see traumatic brain injuries, and so that's another case in which we use the hyperbaric oxygen therapy. And so someone essentially lays in there and they're able to essentially go to sleep, they can read, they can work on a computer or a phone, and at the same time what's really happening is we're super oxygenating their blood with oxygen, which essentially is nutrients, and it's able to get up into the brain where it essentially heals at a much faster pace than what's normally happening, really. The other service we offered was the TMS, or transcranial magnetic stimulation. And so this is used in a lot of cases with treatment-resistant depression. And so what it does is it actually helps increase what we call neuroplasticity, or communication between nerve cells throughout the brain. And in fact, one recent study came out of Northwestern, which was really, really neat, is they're using it now with cognitive decline. And they showed in the study that they took individuals that had cognitive decline and used TMS with them, and they were actually able to, I don't want to say reverse, but they're actually able to evaluate them after treatment, and they had memory comparative to people 20 or 30 years younger than them. So that's very, very neat. Yeah, again, neat thing, TMS.
Thank you so much for taking the time today. It's been very educational. I'm just impressed and blown away about the facilities and everything that you're doing here. Can you just give us again how to get a hold of the Amen Clinic if anyone's interested in where you're located here?
Yeah, thank you so much for coming out. It's always a pleasure to be able to talk a little bit about what we do and help other individuals. And so if you are in need or just have questions about what we do here at the Amen Clinics in Chicago, you essentially can just pick up the phone and call us at 224-804-9220. We're located in the North Shore of Chicago in a town called Bannockburn. The address is 2333 Waukegan Road in Bannockburn, Illinois. So that's it. It's pretty simple.
All right. Thank you so much. I really appreciate it.
Thank you for coming. It's been great.